And I am checking for decap BTLS of the entire extremities, and I'm also checking above and below the knee for offset pressure and crepitus above and below the knee. Ask the proctor, what do I have? For this one, the proctor is going to say it's unremarkable. Also, before you move on away from the lower extremities, you want to check for CMS circulation. You can check a cap refill or check for pedal pulses. Your patient right now is unconscious, so you want to verbalize this. My patient is unconscious, so I can't check for motor or sensory, or else I would. Remember, get your check marks. For motor, if your patient was conscious, you would tell them to press down or push up and wiggle their fingers, and then ask them which finger am I touching or which toe am I touching. Now I'm going up to the upper extremities. I'm checking for decap BTLS of the upper extremities and offset pressure above and below the elbow, checking for any crepitus above or below the elbow. Ask the proctor, do I have anything? It's unremarkable for this scenario. I'm just going over the skill itself. Now I'm going to check for CMS. So I'm going to check for a radial pulse. Do I have a radial pulse? The proctor would say it's present, and then tell the proctor I would check for motor and sensory, but my patient's unconscious. At this moment, I'm going to go ahead and get my imaginary partner. On the count of 3, we're going to move the patient or pull him towards me, and then I'm going to check for decap BTLS of the spine and making sure that there's no step off. So 1, 2, 3. I am checking the back, looking for step off. Actually feel the spine all the way down. And decap BTLS and the buttocks. Ask the proctor, what do I got? The proctor for this scenario right now will say it's unremarkable. All right, on the count of 3, we're going to put the patient back down onto a spinal board, and then we're going to get going. So 1, 2, 3. Patient's on a spinal board. They're strapped up. We are going to the hospital now for this NREMT scenario. Sorry if it's a little loud. They're doing some stuff outside. And before you're almost done, before you actually complete the entire scenario, you want to ask the proctor, I'm going to go ahead or tell the proctor that you are going to check for any secondary injuries. Is there anything that I might have missed, any scratches, minor stuff? And also, whatever you identified that you had to fix on the spot, or you had to get your imaginary patient or partner, to fix for you, go ahead and check on that. Is that still stable? Is it good? Should I go ahead and put more bandages or something, adjust it? And then you're going to state how often you're going to reassess your patient. You're better off going ahead and defaulting to reassessing your patient every 5 minutes. You can't go wrong with that, and it's good for you too. That's it for this skill. On the next video, I'm going to make a video on just the skill itself with no explanation, as if I was an EMT student. There are also going to be other videos made on trauma and how to identify it. So you can watch those trauma videos on eviscerations, femur fractures, arterial bleeds, venous bleeds, and then apply those into these scenarios, and it'll just bring everything together. If you have any questions, leave a comment below, because this is going to be on YouTube. And I will catch you guys next time. Bye.